Afternoon to you. How's the conference been so far?
Back here at the 21st International AIDS Conference right here in the port city of Durban at the International Convention Center. It is a major conference indeed, and people are here not only to work on the way forward but also assess where we've come from. You know, back in 2002 here in South Africa there was about 410,000 deaths that were being experienced. Now that number has dropped to about 180,000. So people are here analyzing where we've come from over the last 16 years since the last conference back in 2000 and mapping the way forward. But it is indeed an important conference to take the fight against HIV/AIDS forward. Let's further this conversation now. Professor Olive Shisana joins me on live. She is the local co-chair of the AIDS 2016. Thank you very much indeed for your time. It is indeed a busy day for you and busy day for the 18,000 delegates that are here. How important is this conference at this very time?
I think this conference is very, very important because the 2000 conference was a game changer. And because it was a game changer, we now need to assess to say, where are we? What have we done collectively as the world, and most importantly, South Africa, which is the epicenter of the epidemic. Yeah,
and the opportunity to act is closing fast, isn't it? So these delegates have a huge responsibility to take this fight forward.
They've got a big responsibility to provide the scientific evidence that they've generated over a period of time in between 2 years or 4 years. They've been conducting randomized controlled trial studies to be able to see what works and what doesn't work. And they'll have an opportunity to share with the whole world what progress they've actually made that would assist us in terms of improving the health of people who are living with HIV.
Let's talk about that progress. You know, we know back in 2000, there was a different climate back then. 16 years later, we have a different story to tell. Talk to us about South Africa's progress in the fight.
South Africa has made a tremendous progress in terms of saving the lives of people by rolling out antiretroviral therapy to now 3.4 million people. It means that we are going to have more people living longer, we are going to have fewer new HIV infections, and most importantly, we are going to have fewer orphans. So that's very important. The second thing that we should be really proud of as South Africans is that we've been able to roll out mother-to-child transmission. In 2000, we had about 80,000 babies that were born with HIV. Today, we have about 5,000 or less that are actually born with HIV. Yeah. That is very good. We didn't have medical male circumcision at the time. Now we do have medical male circumcision as an intervention. We didn't have pre-exposure prophylaxis. Now we do have pre-exposure prophylaxis as well as post-exposure prophylaxis. So when we look at it over the period from 2000 to now, we're seeing a tremendous progress that South Africa has made.
Let's talk about the pre-exposure prophylaxis, PrEP, as it's commonly referred to. What's been the response here in South Africa towards this?
First of all, we're happy that the South African government has decided to give PrEP to sex workers because they are most at risk of getting HIV. Secondly, we'd like to see the South African government have resources to roll it out, particularly to young women. There are many women who are out there ready to be able to use it. And of course, there are still others who are saying, what's that? Why should I be taking a drug on a daily basis? But the majority of people that I've talked to are basically beginning to say, look, here is a new tool that we should use. Can I access it? And it's unfortunate you can access it because at the moment it's still something that is given to only sex workers because of financial resources.
Dr. Shisana, break down the theme for us this year. It's access, equity, and rights now. It's basically a call to action, isn't it?
It is a call to action, and the reason why it's a call to action is that there are too many people that are left behind. In particular, the men who have sex with men, the transgendered people, the sex workers, the injection drug users are left behind, and we want to make sure that we don't leave them behind, we bring them into the fold so that they also can be able to get care. The problem we're still having is discrimination. Stigma and discrimination in this country as well as the world is still a big issue. For us, people of African descent, that is South Africans, Africans, and Africans all over the world, we have the biggest problem with regard to HIV. And we don't want to be left behind wherever we are. Whether we're in the Caribbean, whether we're in Canada, whether we're in the UK, whether we're in remote areas of South Africa, we all want to make sure we get access to care. So we're saying that let's end that. Let's end this problem and make sure that human rights are respected. In many other African countries, and sometimes also in other developing countries and developed countries in the East and the West, people are basically saying that they should not be providing any services because of people's sexual orientation. And we in South Africa are fortunate with the fact that our constitution allows us to be able to, to be against discrimination against anyone on the basis of sexual orientation. But in many parts of the world, this sometimes is criminalized.
Is there a strong enough global movement to change the course of this devastating disease?
I think there is a movement around the world that is saying no to discrimination. There's a movement out there that says we must go out and undertake research, and we must use the research findings that we have, interpret it, and provide services to all people that need it. I was just at a meeting now with the Secretary General of the United Nations, Ban Ki-moon. It was exciting to hear him stand up and say, I believe that we should not discriminate against people because of sexual orientation. And he was saying some people were still against him, particularly if you think about what happened at the United Nations meeting not long, at the high-level meeting, where some of the countries would not allow people to really deal with the questions of LGBT. They don't want people to have to deal with that. So the world is divided on this, but I think there's enough movement, and that's why this conference has decided to focus on those issues in order to bring everybody together, to move together, to try to end this discrimination and give human rights to those people that are denied at the moment.
Professor, thank you very much indeed for your time. I'm sure we're going to touch base through the course of this next 5 days. Thank you very much indeed.
You are very much welcome, and thank you.
Professor Olive Shisana is the local co-chair of AIDS 2016. Well, people are streaming in. We're expecting 18,000 people that are coming to this conference from over 180 countries. They're made up of celebrities like Elton John and Charlize Theron. Charlize Theron is very involved in Africa in particular. She has an Africa outreach program, so we're keen to hear her insights. They'll be all addressing a press conference that's coming up during the course of today. And remember, tonight is the opening ceremony right here at the Durban International Convention Center, in, of course, the Albert Lutuli International Convention Center. They're all here trying to take stock of the global response to HIV and AIDS. It's a unique platform, a unique forum for the intersection of science, human rights, and advocacy. And that's what the people are here to do. They're here to look at ways in which to fight this devastating disease that is actually ravaging many parts of the world. There's about 37 million people in this world that are living with HIV. So the time to act is now. For now, it's back to studio.